World Health Organization says it will study fresh evidence which says COVID-19 is airborne. This after a group of scientists concluded that COVID-19 is airborne and could spread far beyond 2 meters. For reaction to this, we're joined now by the Gauteng Health MEC, Dr. Bandile Masuku. Dr. Masuku, thank you very much for your time. Firstly, your reaction to what's being labelled as circumstantial evidence that COVID-19 is now transmitted through the air.
Good morning and good morning to your viewers. It has been a debate that has been happening around the circles of public health specialists and also virologists, and it's something that we actually welcome. Remember that we are dealing with a novel disease here, which a lot of things will be discovered as we go and as it progresses. And I think this is a wise decision that the World Health Organization is actually taking. We always refer back to the World Health Organization in many respects for guidelines, and we actually respect it in terms of the evidence that they provide when they actually give out the guidelines.
Dr. Masuku, what does this mean then in terms of your prevention strategy in the province of Gauteng?
For me, noting the historical nature of this debate, even how young it is, I think for us to take a decision that masks are an important part of our social distancing and prevention strategy is one of the things that we actually agreed on, because we knew that when you wear a mask, you also have the ability to protect others and to protect yourself from actually getting some of the spats or the droplets, as it is actually suggested. So we have been taking these precautions as we go and also making some amends in that regard.
Dr. Masuku, we've just had a conversation with Professor Alex van der Heever from Wits University, and he says, I want to quote him directly, the uncontrolled outbreak in Gauteng is due to no strategy in the province. How do you respond to that?
Unfortunately, it's one of those things that Professor Alex, the so-called Professor Alex, has actually taken upon himself, and it becomes difficult to argue with him because you are not sure what his views are. But I feel that arguing with people like him who are almost like hired guns, you don't know what is the mandate, and also people who've got fixed false beliefs that they are always right, it becomes a big problem.
When you say he's a so-called professor, what does that mean? Are you questioning his credentials?
Not necessarily. The issue is that, people want to come across as experts on fields that they are not. Commenting on some of the matters that he's commenting on might not be important. But maybe let us, stay to the fact that he is raising an issue about our strategy. Our strategy has been quite focused, and there is a litany of evidence, even in the social media, in the media, on the work that we've done, focusing on hotspots. There is evidence on work that we've done, focusing on communication in terms of social media and mass media that we've done in terms of billboards and everything. So when you talk about prevention not being effective, it becomes a big actually problem. Maybe he must, from his educated point of view, indicate what does he mean when they says the strategies are not working, or there are no strategies at all.
Let me tell you further what he says, MEC, and hence he's raising the question about where is the strategy. He says if it does a comparative study between Gauteng and the Western Cape has attacked the pandemic where they've gone to hotspots, and he suggests that in Gauteng all that you have done here is simply repeat the statements that are made by the WHO, which is constantly behind the science curve, if you like.
Okay, I think let's first agree, Xoli, that let's maybe stick to what Gauteng has done. And also, I think it becomes a big problem when he makes some of the inferences. Like I've said, there's evidence of the work that we've done on focusing on hotspots. I can name all the areas that have been that we've been to. Our strategy has been focused, and we always defer. I think any self-respecting clinician or expert will always refer to the World Health Organization. Only very few people don't refer to the World Health Organization, and we know them internationally what their standpoint is about their beliefs about the virus. So our work that we have done has been led by clinicians, has been led by experts, and has been led by science. Our hotspots are taken starting from when we started our mass testing and screening in Alexander. We went there focused on the area which was a hotspot, even when we went to Merafong. So our strategy has been actually focused, and I think our concentration should be about saving lives and not really comparing who has done what better and where. But I think we are learning a lot from Western Cape, but not in a respect that we can always say that we have not done anything in that regard.
MEC, finally to you. If you accept that COVID-19 is now airborne, the problem with that is that, as the Professor Alex van der Heever said, confined spaces or spaces where there is no proper ventilation become the super spreading areas or spaces, if you like. How do people protect themselves in that instance? Will social distancing still be effective? Will wearing your mask still be effective?
Pretty much so. I think evidence has actually been demonstrated across the globe that wearing a mask is one of also the ways of preventing airborne spread. And it becomes important also to acknowledge that the World Health Organization has put in place a task team which will be working on the matter, and they will give us advice. But I think all the precautionary measures have been taken, and one of them is actually social distancing, which involves wearing a mask. But importantly also is that it's nothing novel what he's saying about the thing. We know that aerosolized droplets, they do hang and suspend in the air under particular circumstances, particularly the air-conditioned actual environment. But there's also work that has disapproved that in a manner that has actually convinced the World Health Organization initially that it's not really airborne. Work that was done in Singapore, work that was done in Hong Kong, and the work that was done in spaces where we're supposed to have got a lot of actual viruses on the air, but when it was actually analyzed, we found that there was no air. So it's something that we have already taken into account, because using a mask is a strategy of preventing any disease that is airborne.
MEC, I know I said it was the last question, but very briefly, I am taking a chance. The professor does say, because I asked him directly whether he is of the view that the uncontrolled spread of COVID-19, as he put it in Gauteng, could partly be attributed to this virus being airborne, and his definitive answer was yes. Do you hold the same view?
Not really. I think it's going to be very narrow and almost baseless if we say that. I think there are a number of aspects that needs to be taken into account. And, in terms of the increased movement that has happened under the lockdown level 3, and also how the outbreaks have happened with people gathering in small groups around, the province. And this is something that is there. So it's not only the only reason, it could be one of them, but not the only. And it's something that is disheartening if a person of his stature would want to reduce everything to his reasoning. People who don't defer to the World Health Organization, we always have a problem with their views and understanding, because it means they don't want to follow science and evidence.
Dr. Bandile Masuku, thank you very much.